had your Botox appointment scheduled and you just got put on antibiotics and you're wondering, can I get Botox while I'm on antibiotics? I am going to answer that question here for you today. And the answer is it depends what antibiotic you're on, and it also depends what we're treating and what area or where you might have your infections. So stick with me today. I'm going to answer those questions for you and give you some really good information to help you make sure that you have your treatment done at a safe time. My name is Dr. Lynn Neiman. I'm a board-certified anesthesiologist. I'm fellowship trained by the American Academy of Anti-Aging Medicine, and I'm the owner and operator here at Blossom Medical in Northern Virginia. I am here to answer all of your questions about elevated beauty, and we can talk about choices that enhance your confidence, your wellness, and your individual beauty here. Let's get into the answers to these questions. Really, the most important thing we need to know is what are we treating and what are we treating it with? So if you have any questions, if you have your Botox appointment scheduled, either write it down on a piece of paper, the antibiotic that you're on, or take your bottle in with you so that your provider can see what you are taking. The only contraindication that is listed in the package insert from Botox Cosmetics and Botox Therapeutic is that there is a contraindication to treating if infection is present at the site of injection. So if you have any skin infection that is on the surface of your face, or a rash or something that you're being treated for that's on the surface of your face, that is a contraindication to Botox treatment. But let's say that you have an infection that's being treated with an antibiotic somewhere else, like you maybe have a bladder infection or you have something else going on that you needed antibiotics for. Common antibiotics like penicillin, amoxicillin, even something like Flagyl, metronidazole, those are okay. You can be on those medications and taking those and still have a Botox treatment done safely. There are medications that maybe could potentiate your Botox effect or your Botox result. One class of medications that can affect your Botox result is something called aminoglycosides. Now, aminoglycosides typically are antibiotics that need to be administered by IV. And so my thought would be, if you're having any administration of antibiotics done intravenously, you are a patient in a hospital with ongoing other medical concerns, and I would simply reschedule your Botox appointment. But the concern there is that those actually can weaken the muscles a little bit on their own, and if we add Botox to that, it could potentiate their effects, and that can lead to an unwanted outcome with your Botox. And so those are an absolute no, you don't want to have a Botox treatment if you are on those. One medication that is more common and that's taken orally and at home is clindamycin. Clindamycin is a medication that can be taken for anaerobic streptococcal and staphylococcal infections. Those are both skin pathogens, and so you might be on clindamycin for impetigo, or you might be on clindamycin for another skin infection. And if that's the case, clindamycin is an antibiotic that could potentiate the effects of your Botox. So what that means is there's some muscle weakness that could happen with the antibiotic itself, and then in the direct concert, so in that action with the Botox, it might make your Botox treatment stronger than you want it to be. And secretly, you might be thinking to yourself, woohoo, maybe my results will last longer. I can use less product and get a better result. But the thing is, you might end up with a really frozen feel, a low brow, or a lid ptosis that lasts longer than you want it to because of the potentiating effects of those two things acting together. So if you're on clindamycin, I would say, no, just finish your clindamycin and we can get to your Botox treatment afterwards. But other things you might want to be asking, or you might ask yourself, well, I'm on an antibiotic and I've been on it for about a week or so and I'm feeling better. Do I need to worry about having a Botox treatment? Will that make my antibiotic ineffective? Will that make me feel worse if I take it, if I have my Botox treatment? So let's talk about some of the other things that could potentially happen. While you're taking an antibiotic, that's a systemic medication. That's kind of going everywhere in your system. Botox is really different. It is a very localized injection. So we are very targeted and specific with where we inject that medication, specifically in your muscles of facial expression. So we expect that medication to have a mostly local effect, but not really spread systemically. So there is no clinical evidence in the medical literature, and there's no real evidence for us to think that injecting that Botox in a localized way will have any systemic effect that would, let's say, lower the effectiveness of your antibiotic that you're taking. So your antibiotic should still be treating what it needs to be treating without having any untoward or negative effects from that local Botox treatment that's going on when we do Botox for your muscles of facial expression. Also, something that you might be thinking about, well, if I'm taking antibiotics and I take Botox, will that make me feel worse, or would that make me feel better? Am I at risk of having any recurrence of symptoms or anything because I'm taking Botox, or lower the effectiveness of my antibiotic? I do really want to say that sometimes when people have a Botox treatment, they might have a little bit of a low-grade headache later on that day. That's a known and well-documented side effect of having a Botox treatment. So it's possible that after a Botox treatment, you might have some of those kind of symptoms of maybe a little bit of low-grade headache, or just maybe just feeling a little bit of that procedure. But it shouldn't actually make you in any way contribute to infection, sickness, illness. That's just part of that Botox process that is completely separate from that antibiotic process. So I wouldn't expect the Botox to make you sick or potentiate any illness that you had that was being treated with your antibiotic to begin with. Should you have any other considerations before going forward if you're on an antibiotic and you're coming in for your Botox treatment? And this is a really specific and individual thing. If you have a condition like diabetes, if you have an autoimmune disorder, if you have any other mitigating effects that might make you just a little bit more sensitive during the time of an infection that's being treated with antibiotics, that might be a time for us to slow down. And just remember, your Botox treatment is an elective treatment. We can schedule that when it's convenient and when it's good for you. And so if there's something else going on with your medical history that maybe we're not to the bottom of yet, and you've got other medical comorbidities that will contribute to your overall health, we can always take a beat and we can take a pause, because we will be here to treat you with your Botox another day in the future. So can you have Botox while you're on antibiotics? The answer is yes. The true contraindication is if you have an infection at the site of where we would actually be doing your Botox. So if you have a facial skin infection that is being treated with an antibiotic, I would say put the brakes on, let's wait, let's come back and do your Botox another day. If you have other comorbidities, such as diabetes and autoimmune disorder, and you're on antibiotics, maybe that's a time we want to just reevaluate and see if now makes sense for you. If you are on clindamycin, I would say let's finish up your clindamycin and let's come back and do your Botox another day. But if you are on penicillin, amoxicillin, if you are on another antibiotic like Flagyl, or like metronidazole, and you come in for your Botox treatment, your infection site or the thing that we're treating is far away from what we're treating with Botox, which is on your face, then I would say it's absolutely fine to go ahead and treat you. If you are feeling unwell with fevers, aches, pains, malaise, you're just not feeling great, just reschedule your Botox appointment. But if you're feeling well, you are on your course of antibiotics, definitely bring in the bottle or write down the name so that we can have a discussion about what is safe for you. And just make sure that the choices that we make are going to be serving you the best way. I hope that's answered your questions about whether or not you can get Botox while you're on antibiotics. And if you found this helpful, definitely subscribe. If you have a friend who might really think that this content is valuable or helpful as they make their own decisions, I would appreciate it and really, really be grateful if you would share this information with them. We are an office in Northern Virginia, and I'm sure many of you across the country have different offices. So I just want to say I am a medical doctor, but not your medical doctor. Make sure you take this information to them so that they have a chance to talk with you, counsel you, and make the decisions that are best in their hands as well. If you are in the Northern Virginia area and are thinking about getting Botox, we would surely love to have the opportunity to do a consultation with you and let you know about our philosophy and how we approach doing that here at Blossom Medical in Winchester, Virginia. But if you live further away, we certainly know that there are many amazing providers out there. The one thing we can reach out to you and talk with you about is amazing skincare. We believe in the transformative power of medical grade skincare and do offer virtual skincare consultations, and would be happy to just set up a time to make an individual skincare plan with you if that's something you're interested in. And you can find the links below. If you're looking for those, in the description below, click that ... That will have all of the ways to reach out to us and all of the links that you need. Please feel free to subscribe and tune into other videos that we have to give you information. If there's anything else that you would like to just come to understand or would love some video content on, leave that in the comments below. We'd be happy to read those and know what you find valuable and maybe what questions that you have. So again, we appreciate being part of your wellness journey and really are hoping that you find this content helps you make smart and educated choices going forward. Thanks a lot for tuning in today. I really appreciate it. See you next time.